Okay, good on you. Ninja, you're doing well, mate.
Thanks, man.
You're a good client.
You're coaching me well. Coaching me.
Now, the second one is, oh, sorry, mate, is right in there. Ready?
Whoa.
Right in there.
Ah.
There, that's it.
That's dear, mate.
Yeah, that's it. So we'll just hold it. Hello, everyone. This is Fancy from MMT, and this is Ninja. Welcome, Ninja.
Thanks for having me.
I'm kidding.
Yeah.
No, you got to start it.
That's the best intro you've done.
Hi, everyone. This is Farnel here, and I'm here with my good mate Ninja, and he's going to be the prop here for me today. So what I'm going to be doing in the next 12 weeks, I will be doing videos on the entire body, starting from your neck all the way down, and what sort of treatments I would do, so that when you make a booking and come and see me, there's nothing that is a surprise to you, okay? So today I'm starting with your neck, and so my question to you is, are you experiencing tight shoulders and neck? So just sitting behind your desk, okay? Is it affecting the quality of your work, right? You need to be thinking about that, because the niggly feeling can stop you from working properly. Me personally, I see so many clients that sit behind a desk and they're experiencing this tightness and discomfort, which can potentially lead to tension headaches, okay? So we need to ensure that it doesn't get to that stage, all right? And I would hazard a guess to say that you probably, as an office worker, have been putting up with that for a very, very long time. But I want to pause there and just say something else, and just not office workers. I think we were just discussing before about our phones, and I think our phones are a culprit too for everyone. We're always doing this, okay? Now, it doesn't seem much when you're bending your head down like that, but that is equivalent to about maybe 20 to 27 kilograms of weight that your neck muscles are actually putting up with, okay? And that's a lot, and over time there'll be a lot of tension there, and you want to release that. Now, the other thing that happens, which I've discovered, is that tension becomes people's norm, and so they don't know that they can be better, okay? So it's important that that gets treated. The other thing I want to say, it's not just your neck and shoulders that are tight. You think about sitting. You always got your hip flexors tight. Your thoracic area could be bent. Your lower back, you haven't got correct posture, and you can have pain. Your glutes and other things. So there's quite a number of other things that can affect you and make life awkward for you, okay? I know too that with your work, you can get so involved in trying to finish the work you do that you forget about wanting to have a break, or not thinking about your seated posture and things like that, okay? So, and you are doing yourself a disservice, all right? So you need to actually get treated so you can break out of that. Now, to maintain longevity in your work, you have to look at after yourself and just ensure that you're treated. And which better place to be treated than at Melbourne Muscular Therapy, okay? Just look at our reviews, 4.9 out of 5. Whoa. Absolutely fantastic. Isn't that fantastic?
Great.
And read the reviews that I have. And so
they're the best
that's
ones.
the most important one.
We've got bots out there working overtime.
Exactly. So, so that's the initial thing I want you to talk about. So I want you to know what I'll be doing when you first come in, okay? So when you come in to see me, your first visit, I'm going to do just a full postural assessment, okay? So I'm going to use Ninja here as a prop. So Ninja, if you can just stand there, mate, and can you just turn around for me, please? Okay. So what I'll be doing is I'll be basically just checking to make sure that he's level, he's not lopsided. Okay. So just check his hips, make sure he's okay. That's good. Can you raise your left arm, please, mate? Thank you. That's good. You don't have an anterior tilt. You're the healthy specimen, Ninja. It's very good. Now, the other thing I'll be doing is I just want to see how many toes I can see from behind of his... Okay. Because sometimes what can happen is that you may be limited in your internal and external rotation. So if your pelvis is not allowed to externally rotate, you can't squat properly, okay? You'll feel pain. So you want to get rid of that. The other one that I want to check is this. I want to make sure that his shoulder tip is in line with his ear. Now, what I find with most people behind desks, they're like that. So it's a couple of inches forward, right? So we need to correct that forward head posture, all right? So what happens is all these muscles are so tight and these ones here are weak. So we need to release those and strengthen the sternocleidomastoid muscles, okay? The only other thing I noticed is just a ninja's scapula. It's kind of just a little bit away from his thoracic area. What I want is for that to be in rhythm with his thoracic area. So one thing I would recommend Ninja to do is get a TheraBand and do rows. Pull it and hold it for about 5 seconds, release, and just continue to do it. That'll be a set of 10. And that strengthens your rumbar, so it brings the scapula back in place, okay? So, but I would be treating something like that. All right, that's what I'll be doing. Now, Ninja, turn around please, mate. Okay. Turn around, face me, okay. So if I was going to be testing you just to see, as I did this morning with a client and treated him last week, his ability to move was about 40%, came back today and told me it was 90%, okay? Awesome. There was just a little bit left that we ended up working through it just to release it. Now he's coming back on a monthly basis, all right? So it does work, it really does. And you can just be free of that tightness and that pain. So important. All right, so let's say it's a Ninja's neck, right? So I'm going to ask Ninja to just look down at your toes slowly, but I want you to stop when you're feeling stretch or pain. So do that. You're pretty good there, okay? Yeah. So if you're feeling pain, let's say your head was up here, then definitely there's tightness there, okay? Now come out of it and extend your head up. You're looking at the ceiling. Okay, nothing there. Right, come out of it. I want you to rotate your chin to your left shoulder. No, don't look down, just straight. Just straight, yeah. Okay, a little bit limited there. Now it should be at 85 degrees, okay? Now the other way for me. Do you feel tightness anywhere along there for you?
A little bit there.
Along there, yeah. What about that side? Do you feel it along here, that tightness?
It might be just here, okay. A little bit tight, but yeah.
Good, it's good information for me. Right, now what I want you to do is lean your ear to your right shoulder. How does that feel?
Good stretch.
Stretch, are you tight?
Yeah, a little bit.
Okay, all right. Come out. There is an element of that stretching, but in comparison to this way, how does it feel?
Pretty simple. That one's got a different kind of
much
stretch.
More.
Different.
So
different
which
area.
one feels like stretch? Which one feels like tightness? Where
they both feel like a good stretch.
Okay.
Maybe this side, right.
A little tight. Okay. Because they'll be synonymous with what you're feeling there. Okay. All right. That's good. The other thing I just want to make sure is just your shoulders. So can you just raise your arms all the way up for me? Okay, you're not feeling any resistance there at all. Bring them down and extend your arms all the way back. Pretty good, great. Yep. Now come, now raise your left arm, just your left arm, all the way up, 180 degrees. Pretty good? Yep. No limitations? Okay, now the other way. Okay, now I want to make a point here. With people that have upper shoulder and neck problems, when they do that movement, they feel tightness in the upper traps, okay? So, oh, sorry, mate. And it could be this muscle here. That's your supraspinatus, that there, okay? And the way you treat that is by just holding 2 pressure points and releasing it. And you wait for it. It will release, but you got to wait. You can't give up. None of this 15 seconds, all right? Now, I want to make sure that it is those 2 muscles, the upper traps and the left scap muscles, which are these. I'll show you here. So it's this muscle here, upper traps, and this one here, the left scap, okay? Connects from the medial border of your scapula and goes to C1, C4 of your neck. Now sit down for a sec, please, mate. What I'm going to do is have your arms by your side. So you flex them. Flex them? Okay. Now relax. Now have them there. Okay. You don't do anything. I will just raise your arms. Okay. Now you rotate to your right. To your right. So you went a lot further. Okay. Now do it the other way. Much further. Okay. So just lean to your right shoulder. Okay, now the other way. Better?
Yeah.
Okay. So to me, that means that's a positive test. It means that it's either your upper trap or your left scap that is involved in it. So we'll release those, okay? Now that I've done that, what I will do is I will start on Ninja to treat him. So I'll ask him to lie face down. Please, Ninja. Okay. All right, now is the headrest comfortable for you, mate?
Yeah, man.
Okay. All righty. Okay. One thing I find with clients is I will, let me just a little bit, just so that I can glide. I find that people that have got tight shoulders, sometimes just by pressing and holding it, I'll just wait till he relaxes and his central nervous system realises it's not a threat, I will hold and I will slowly glide. Okay, so I won't press too much at the moment, but I will slowly glide and it just stretches that fascia. And see, I can feel some tightness there, right down your right side, straight away.
Yeah.
Okay, you've been on your phone, haven't you?
Yeah.
Yeah.
Deleted the abs just before, mate.
Yeah, I know. No, you should be fine in 4 weeks' time, mate.
Yeah.
That's what I expect. You're tight there. I can feel that. Okay, that's very right there. That all of that I can feel. So one of the muscles that you have, it's a extrinsic muscle. It's a semispinalis, and that connects from your occiput, okay, the nuchal lies right here on the other side, and goes from C4 to C7 and from T1 to T6. So it's a fairly long muscle and can cause you grief. So I'm going to apply a little bit more pressure, Ninja. Are you okay with that?
Yeah.
Okay. Now I'll tell you what the reason why I'm doing that is I find when I do this for some clients, you'll hear a crack here or there, okay? So they've had a really, a vertebrae that's out of place, and if that's not right, you can do whatever you want to the muscle. It's not going to release it. So, and it happened this morning when I was treating the guy I was telling you. On one side, on his right side, which where his issue was, there was just a crack and just releases it and feels good. Okay. Now, I find this section here, the laminar groove, next to his spine, tends to be a bit of a collection duct for tightness. All right. So what I will do is I'll just press against that. Just get the slack out. Just apply pressure right against the spine there. The second pass I'll press harder, but I just want to make sure that he's okay. Yeah. I feel something there, Ninja. Can you feel that? Yeah.
Yeah.
Okay.
A bit of gristle in there, isn't there?
Yeah. So Ninja looks after himself by exercising and, you know, is not seated behind desks all the time. Whereas people who are, your health is really limited and you become so accustomed to it. Like I said earlier, it becomes like as if it's your everyday norm. And it's not until you get a treatment that you realise what your norm should be like. I think one of the primary things you need to do is look after yourself, look after your body. Because if you do, you can enjoy life. Okay, well done, mate. All right, now, I'm going to be a little bit more focused with my thumb. I'm going to press a little, just a little bit of this. Okay, just a little bit. Okay, here we go. All right, just in there. You okay?
Yeah.
Just in there. There you go, right there, Ninja.
Yeah, mate, you're on it.
It's just releasing. That's good. Keep going. And you can actually feel the tissue under your thumb just releasing and relaxing. And of course, you confirm it with your client to make sure. There, right there. Okay, that's tight there. I can tell you that. That's his withdrawal systems because he's giving up his phone. Hey?
Yeah.
Okay.
Get it out.
Exactly. That's tight, Ninja. I can feel that.
What are you giving up, Farnsey?
What am I giving up?
Yeah.
Sweet things, mate.
Sweets?
Like chocolates.
Chocolate?
Yeah.
Sugar?
When I first started training, I could walk through an aisle of chocolates and biscuits and it didn't affect me. I didn't need to buy it. I wasn't tempted or anything.
Yeah.
But over time, I've actually allowed it to creep in.
Yeah.
And I'm eating mainly of an evening. There, Ninja, that's tight.
Yeah,
And I find that I can't stop at one.
Yeah.
So it's like when you pop, you can't stop.
Yeah.
So I keep on eating. And it's not good for you because, you end up putting weight on. And I don't want that. So I'm stopping that. And I'm looking forward to it, mate.
Yeah, you're going to be ripped.
Yep. My only disappointment is that I've still got a packet of biscuits left.
Don't worry. Throw them away.
I've got to give them away.
Give them away. Give them to somebody else. They can have it.
Exactly.
So we're going to do it before and after. Maybe we can
Maybe.
take a photo of your belly now.
Yeah, and see what my love holes are like, and then what they're like afterwards.
Yeah, that's right. We can do some measurements.
Exactly.
Put the tape around you. And
Correct.
well, I think we might have a bench press session tomorrow as well.
We do.
Yeah, we've locked it in.
Yeah, I don't want to embarrass you.
I put it in a diary.
I know you did. I know.
That's
How
the way.
did that feel,
Good.
Ninja?
It's nice having it in the diary.
I know. I know.
Sorry, man.
I know, which means you've got to use your phone.
We've got to have it. We're going to meet up in person.
I know. Now, the other thing I will do is I'm going to ask Ninja to put his left arm by his side. His left arm, this right arm, sorry, my apologies, right arm by his side. And I want you to put your thumb underneath your thigh so it doesn't slip off. Okay. So I'm going to just, I find that around here, a bit of a collection duct for tightness as well. So the first thing I ask is this first part of the scapula, are you feeling any tightness or pain there at all? No. Okay.
No, it's pretty good, but it's therapeutic.
I know you're okay. I find with clients though, once I come around to this corner where the left scap is, right here, that's when people start feeling it. I know you're not.
I do. I've got some old stuff, but it doesn't worry my function too much. But there is some old scar tissue.
So I just hold it. Normally I'll just hold that until it relaxes. And it can, if it's really tight, what can happen is you can have referral pain going behind your neck. And if it's really bad, it can go all the way to the top of your right eyebrow. Okay? So, and what I find is usually if you pin and hold that muscle and it begins to relax, your pain receptors reduce and that referral pain stops.
Whoa, That's good. Feels good. It's therapeutic.
There.
Ah, dear, oh dear.
So the other thing I want you to know is I work within each individual's pain level. So I don't kind of smash all clients or anything like that. I work on a scale of 1 to 10 in relation to pain. So once we get to a 7, I ask people to tell me and we stop and wait till that pain dissipates. And when it dissipates, I'll press some more just to make sure we've cleared it out, okay? I don't want your muscles to tighten up so much so we can't do any effective work. Okay, now, I did mention the two muscles, his upper scap and the left scap here. So what I will do is I will just sit there and I'll just hold that. Keep it under pressure. Are you okay?
Yep.
All right. Just relax that. Just wait for that. And after this, I'm going to go straight to the that supraspinatus muscle that I showed you. I find that to be implicated with a lot of shoulder issues. Okay, so what I'll do with the supraspinatus muscle, there are 2 points, pressure points that I'll be pressing. So I'll be holding there and I'm pressing in there. Are you okay?
Yep.
Okay. Now, usually I'll ask client, like, what's your pain level? And if it's just a 2, I move on. But if it's more, like 4 or 5 or whatever, 7, I just hold there and I'll wait. And sometimes you can have referral pain all the way to your shoulder because that's where it attaches as well. Okay, good on you. Ninja, you're doing well, mate.
Thanks, man.
You're a good client.
You're coaching me well. Coaching me.
Now the second one is, oh sorry mate, is right in there. Ready?
Whoa.
Right in there.
Ah.
There, that's it.
That's it. Dear, oh dear, mate.
Yeah, that's it. So we'll just hold it.
Oh.
I know.
Yeah.
And as it releases, sometimes what I do is I don't tell the client, but I will press some more and then I'll check with them regarding the pain level. And majority of the time they say, like there wasn't any pain, they were fine. And then I tell them, well, I pressed harder, which is good. It's always a good sign that we're clearing it out. All right, so I'm pressing more. Ninja, you okay?
Yeah. Oh, dear. Shit.
Okay.
It's better.
So for the sake of the video, I'm going to move on. But the other part is, I find is an issue is just up here. Just in this area here. Just in there. Right in there. And that can be a point of pain as well. So you just sit there and hold it. It's uncomfortable holding it like that, but it is really effective. I can feel a bit of tightness there, Ninja.
Yeah.
So as it relaxes, I'll press some more and see if there's any more left. And of course, it's a slow process. Right there, I can feel that there, Ninja.
Yeah.
You okay?
Yeah, it's good, thanks.
Okay. Okay. And the occipits are actually an important part. Yeah. So press that. And I'll ask Ninja, are you feeling anything there, Ninja?
Not too bad there.
Not too bad there? Okay. So I'll move on.
Whoa. Yeah, there.
There? Okay, all right.
Yeah,
just hold it.
That sucks. Occipitalis, is it? Something like that?
Sorry?
Occipitalis?
Yes, they are. They are.
Whoa.
Can lead to tension headaches, so we don't want that.
Yeah.
So I can feel that's beginning to relax a bit. So I'll just hold it until I'm comfortable with it, that it's done the work that needs to be done. I just want my clients to feel better when they leave, then come back and feel like nothing's happened at all. Okay, and now in here, Ninja, just in there. Anything there?
No, that's fine.
Okay. The only other one I will check is just under your mastoid process, right in there.
Yeah.
What are you feeling there?
That's all right. It's just.
You okay?
Yeah.
Okay. All right. All right. So what I will do now is, I've tested him, I've treated him. I'm going to retest to make sure that we've been effective. So Ninja, can you please stand up, mate? Stand up. Okay, stand. Okay. All right. So I know. All right. Turn around, face me. I know. Just take it easy. Okay. Now, rotate your chin to your right shoulder, please, mate. Yeah. Good. You've gone a lot further without raising your scapula. Good. Now the other way for me. Don't remove your shoulders, just your neck. Okay. Feels like there's a bit of tightness there. Is it along here? Did you feeling it a bit?
A little bit, yeah.
Yeah, okay, all right. I'll fix that. Okay. So I'll give you an example. Yesterday I had a client that I treated that even this morning when I treated them, doing that test again, they were feeling really tight. So just to make sure, I get them to sit down. Sit down, Ninja. Okay. So what I will do is I will pin that, and for now, and then the second time round, I'm going to be asking Ninja to actively move his neck, okay? I'll show you what I mean. So he's going to be doing that under tension to lengthen the muscle. Okay, now I want you to lean your ear to your left shoulder, go, and come back to the center. Come back to the center, and do it again. No, just stay on one side. Left, and come back to the center, and go again. Just keep on going, just do that. Just do that. Good. Okay, let's do it again, mate. Okay, do it again. Lean over. And do it again. Now I want you to stop. Hold it there.
On a good spot.
Yeah. Okay, we'll just hold that. Okay, now Ninja, come back to the center. Now rotate your chin to your left shoulder. and come back. Keep on doing that. Okay, and just for one more thing, because he said something else was tight, can you please just lie down on your back for me, please? So I just want to treat those sternocleidomastoid muscle. Okay, you all right?
Yeah.
Okay, here we go. Okay, so this is one. Grab this, just tighten it. Yeah, that's it. I'll hold that. I'll just pinch it. That is sternocleidomastoid muscle, where it attaches to here. Okay, so I'll just keep it. And all you're doing is just holding it, just to release it. It's unusual and it's uncomfortable, but it's good. Okay, tighten your neck. That's it. Okay, I've got it. Good. Okay, now, okay, tighten your neck, just there. What are you feeling there?
Yeah, bit of
tightness?
tightness.
Sorry, mate. Just a teardrop on you.
You're crying, mate. They're free.
No.
Bit extra.
Okay, so I've done that. Now I'll get him up again. You stand up, and I'll just get you to rotate your, stand up, look at me, rotate into your left shoulder, rotate. Don't look down, like just rotate, okay? Better, now the other way. Better, now lean your left ear to your left shoulder. That's better. Now the other way. Better. So it's, all he wants to go at 45-degree angle with the lateral flexion, okay? You don't need to go more than that, right? And what I will give someone who works behind the desk, just an exercise, what I ask you to do is, if your ear was really forward, yours is not, but let's just pretend, okay? I want you to pull your chin really hard into your spine, okay? So that's in line with your shoulder. Now I want you to put your palm on your head. I'm going to push forward with your head and stop yourself with your hand. You're going to feel these tightening, so you're strengthening those. You feel a bit of tension there. Hold it for 3 seconds, release, and do it again. Pull your chin in first. You don't have to press too hard, just a bit, okay? Okay, and again. Pull your chin in, okay. So, that's enough. So what I want you to do is, I want you to really internalize posture, good posture, right? So I want you to do that exercise 5 times in one sitting, right? So you can do it 3 times at work and twice at home. It only lasts for 15 seconds, okay? And I want you to begin to realize how far you're leaning forward. And over time, you will become so conscious about it, you're going to put less pressure on your neck muscles and you're going to be in a better state, okay? So if you can do that for me, that will maintain longevity in your work. All right?
Beautiful.
So,
feel good.
If you are an office worker and you know you're in an uncomfortable state, you know your shoulders are tight, don't wait. Book, come and see me, I will help you. You will be amazed how good you will feel, okay? All right, Ninja.
He's an awesome man.
Yeah.
Get it done.
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 Okay. See you guys.